Hi guys, today I'm going to discuss about the radial nerve. Radial nerve is one of the main branches of the brachial plexus. I'm going to focus on the course of the radial nerve on the plastic model. I'm going to discuss the root values of the radial nerve and also show you which muscles and skin are innervated by the radial nerve. And finally, I'm going to focus on the vulnerable sites of the radial nerve. So as I showed you in my previous video, the brachial plexus is formed by these roots, and these roots give off some trunks. You see here upper, middle, lower trunk, and you can see the divisions, cords, and the branches. If you look at here, the radial nerve is a branch coming off from the posterior cord. You know we have lateral, medial, posterior cord, but the radial nerve is a main branch coming off from the posterior cord. And the posterior cord is formed by joining the three posterior divisions of the superior, middle, and inferior trunk. So it means that the radial nerve have the root values C5 to T1. I mean all roots of the brachial plexus are contribute to forming the radial nerve. C5, C6 through the posterior division of the upper trunk, C7 through the posterior division of the middle trunk, C8 and T1 through the posterior division of the inferior trunk. They come together, make a posterior cord, and then finally make the radial nerve. So the radial nerve's root value are all C5, C6, C7, C8, and T1. Now I'm going to show you the course of the radial nerve. If you look at here in this plastic model, here is the armpit or axilla. You can see the axillary artery. So at the back here we have the radial nerve. This is the radial nerve. Hopefully you could see here, if you look at closely, the radial nerve is a branch from the posterior cord. So as it's a branch from the posterior cord, it's going back to the posterior of the arm. So if you look at here, this is the humerus. At the back of the humerus we have posterior arm muscles. So the posterior arm muscles is known as the triceps brachii. Tri means three, ceps means head. So it has three heads: long head, lateral head, and medial head. This is the long head. It is really long and it's going further up and attaching to the scapula, whereas the lateral head and medial head, they are attaching to the humerus. This is the lateral head. Laterally we have lateral head, and medial to the long head, here we have the medial head. So both lateral head and medial head are covering a groove here. It's called the radial groove, spiral groove, on the back of the shaft of the humerus. So if you look at here, this yellow color represents the radial nerve. So radial nerve passing through the radial groove or spiral groove of the humerus that is sandwiched between the two heads of the triceps. I mean the lateral head and medial head, sandwiching the radial nerve. And you can also see that the radial nerve traveling alongside the this artery, profunda brachii. Profunda means deep. Deep branch of the brachial artery is traveling alongside the radial nerve. Then radial nerve going down, and if you look at here, on the lateral side of the elbow, this is the elbow, just a little bit above the elbow here. Laterally we have a muscle. It is called brachioradialis, coming from the arm, going down to the radius, brachioradialis. So deep to the brachioradialis, we have radial nerve. So it emerges here on the lateral side of the elbow between the brachioradialis and this muscle, brachialis. And then you can see how the radial nerve splits into superficial and deep branches. So superficial, you can see that it's running all the way down, and it's just deep to the brachioradialis muscle. And you can also see that how it's emerging just above the wrist joint here, lateral to the tendon of the brachioradialis. And it gives off different branches to the dorsum of the hand, supplies the skin on the dorsum of the hand. So we'll discuss it shortly. What about the deep branch? This is the deep branch. It's a little bit more larger, so larger than the other one. So it's piercing this muscle. It's called the supinator. It passes between the two heads of the supinator, going back and supplying all posterior forearm muscles. So the radial nerve coming from the posterior cord, it's supplying posterior arm and posterior forearm muscles. All posterior arm and posterior forearm muscles are supplied by the radial nerve. It also supplies the skin covering the posterior arm, posterior forearm. It also supplies the skin covering the lower lateral side of the arm as well. And as I mentioned before, the superficial branch of radial nerve is also supplying the dorsal surface or posterior surface of the lateral 3/2 fingers and corresponding skin on the dorsum of the hand. So it's supplying the skin on the dorsum of the thumb, index finger, middle finger, and lateral half of the ring finger. And it also supplying the skin just next to these fingers. So this is the course and supplementation of the radial nerve. And what about the vulnerable side? So there are some parts of the upper limb that radial nerve can be compressed, and it is more vulnerable to be compressed and make a pain. So as I mentioned before, here in the radial groove of the humerus, when it's sandwiched between the lateral head and medial head of the triceps, it can be compressed by these two muscles. It's one of the vulnerable sides of the radial nerve. The other vulnerable site is here. As I mentioned before, it passes between the heads of the supinator and piercing the supinator, so it can be compressed. So this is the another vulnerable site of the radial nerve. Thank you so much for your attention.